Good morning, this is Dr. Reese coming to talk to you today about the relationship between gum disease, also known as periodontal disease, and systemic health, which relates to the whole body. For years, it was thought that there was a correlation between dental disease and the systemic disease. However, only recently have we really gained much research to support that. Now, for many years, it has been known that the gum disease greatly affected people that had diabetes. That has certainly been proved. The other thing that gum disease can affect is heart disease, also osteoporosis, respiratory disease, cancer, heart disease, and stroke. Initially it was thought that it was the bacteria in the mouth was the factor that linked periodontal disease to other diseases in the body. However, the most recent research demonstrates that inflammation may be responsible for the association. Therefore, treating inflammation may not only help manage periodontal disease, but may also help with the management of other chronic inflammatory diseases. The relationship between diabetes and periodontal disease: diabetic patients are more likely to develop gum disease, which in turn can increase blood sugar and diabetic complications. People with diabetes are more likely to have gum disease than people without diabetes, probably because people with diabetes are more susceptible to contracting infections. In fact, periodontal disease is often considered a complication of diabetes. Those people who don't have their diabetes under control are especially at risk. Now, the relationship between gum disease and heart disease has been recently studied, and a definite correlation does exist where it shows that periodontal disease causes or is an association with heart disease. While a cause and effect relationship has not yet been proven, research has indicated that periodontal disease increases the risk of heart disease. Again, scientists believe that inflammation caused by periodontal disease may be responsible for the association. Periodontal disease can also exacerbate or make worse existing heart conditions. Patient at risk for infective endocarditis may require antibiotics prior to dental procedure, and your dentist and periodontist or cardiologist will be able to determine if your heart condition requires use of antibiotics prior to dental treatment. Also, stroke. Additional studies have pointed to a relationship between gum disease and stroke. In one study that looked at the causal relationship of oral infection as a risk factor for stroke, people diagnosed with acute cerebrovascular ischemia were found more likely to have an oral infection when compared to those in the control group. Other interesting diseases that are related to gum disease are osteoporosis and more recently respiratory diseases such as pneumonia. It is known that the bacteria from the mouth in an infected mouth can be breathed into the lungs and cause pneumonia. And finally, the last one that is being researched right now is that research has found that men with gum disease are 49% more likely to develop liver cancer, 54% more likely to develop pancreatic cancer, and 30% more likely to develop blood cancers. Again, it is the best way to prevent gum disease and many systemic diseases, to at least help control them, is to see your dentist regularly, get your mouth cleaned and get it in good health, and the other factors will be mitigated.